treatment for the poor. I think again, referring to the United States, the American model, there poor people receive healthcare through Medicare or Medicaid, through the government-funded healthcare systems. The difference in England, and in the United Kingdom, especially in England, is that everybody is entitled to have any free healthcare, to have the free healthcare they need. So it's not a case of poor people not having healthcare because they can't afford it. They will be, if they need it, they will be provided. The difference within the National Health Service, our challenge is that we provide the free healthcare. People can access the free healthcare, but they still don't access it when they need it. For instance, diabetes, or help with living healthier, with stopping smoking, eating healthier, taking more exercise. We provide those services. Our big problem is getting people to use them. They're free to the people. They are free to the people. They are free to the people who need them. They don't have to pay for it. It's provided by the government, but people still don't use the services. And so people who have money, people who are richer and are better educated, tend to be far better at using services, and they make good use of health services. They get the services they need, whereas people who are poorer or have less education don't have such an understanding about what healthcare they need, and so they don't access the healthcare even though it's there for them, and even though it doesn't cost them anything. What that means is that people who have more education make much better use of healthcare services, and so their health tends to get better. People who are poor or have less education tend to make worse use of healthcare services, and their health tends to get poor, and the gap between them gets wider and wider. So again, the gap between the gap in life expectancy, the gap in how long people live between the rich and the poor gets wider, even though theoretically, even though they both have exactly the same access to healthcare. Which is an interesting point, and it's an interesting thing that when we talking to our American colleagues, they found very interesting, in that they're fighting to get healthcare for poor people, to narrow the gap. We've got free healthcare for poor people, and our gap is still getting wider. So it's very interesting trying to understand how we can educate people, how we can get people to understand they need to access the healthcare. And again, the other thing, because when people have more money or have more education, they recognise early symptoms far more. So they will recognise when they have a health problem, or they will have regular checkups. Whereas people who have less education or are poor are a lot less likely to have regular checkups, and tend to present with an illness when it's much further along. So their illness is a lot worse before they come into treatment, and so their outcomes were a lot worse. So I think that's the interesting thing about the healthcare system for the poor. We have a healthcare system for the poor, the same as we have a healthcare system for the rich. It's theoretically the same healthcare system, but we still have those same very large gaps between how people use those free health services. So it's a very different challenge from where you've got a private system where it's about providing the healthcare. We've got the healthcare, we just can't get people to use it.